Hello, everyone. My name is Dr. Jeff Greason, and I'm a psychology professor at Rowan University. Today, I'll be talking about the results of a recently completed study called Does Physician Compassion Predict Postoperative Pain and Opioid Use in Surgery Patients? A prospective cohort study. I have no actual or potential conflicts of interest to disclose for this presentation, and our funding was received through Rowan University as part of the Camden Health Research Initiative, a collaboration between Cooper University Healthcare and Rowan University through the Mindfulness, Stress, and Health Lab. The study is important because in the United States, we have an epidemic of chronic pain and opioid use that's costing society over $600 billion per year. And there's a strong link between surgery, pain, and opioid addiction because postoperative pain is one of the leading causes of chronic pain. And poorly managed postoperative pain is a high risk factor for opioid addiction. Yet little is known about the potential therapeutic role of physician compassion in determining surgery outcomes. A couple of my colleagues at Cooper University Healthcare, Dr. Brian Roberts and Dr. Steve Treziak, pictured here, recently developed a very brief 5-item compassion scale that patients can fill out to ask about how they feel their healthcare providers, in the context of this study, their anesthesiologist, how compassionate they are towards them. Questions include things like feeling cared about in terms of emotional and psychological well-being, feeling as if your healthcare provider is interested in you as a whole person, considerate of your personal needs, able to gain your trust, and showing you care and compassion. Our research question for this study was, is higher physician compassion associated with lower levels of patient anxiety before surgery, lower levels of pain after the surgery, and lower levels of opioid use for the first 3 days after surgery? The methods included a prospective cohort study between March of 2021 and June of 2022 during COVID at Cooper University Hospital in Camden, New Jersey. And patients were same-day surgery patients, 18 years of age or older, coming in for abdominal or extra-abdominal surgery. And our main statistical analysis was path analysis. We had 136 patients take part in the study, ranging in age from 18 to 80 years old, with an average age of 51. 85% were female, about 2/3 were white, about a quarter had a college degree, and there was a mixture of different types of surgery. And patients on average were obese, and a quarter of them were current smokers. In terms of the results of the path analysis, our main findings were that patients who rated physician compassion scores higher for their anesthesiologist had lower levels of state anxiety before they were going into their surgery, after they met with their anesthesiologist. So higher levels of physician compassion correlated with lower levels of state anxiety, which in turn were related to lower levels of pain on postoperative day 1 after the surgery. Lower levels of pain on the day after surgery was correlated with less opioid use, and that connection was the same for the second and third day after surgery as well. Lower levels of pain, less opioid use, as we would expect. This model fit the data well, and all of the direct links shown here with the black arrows were statistically significant. But what we call the indirect effects of physician compassion on pain and opioid use were not quite statistically significant, with p-values between 0.19 and 20. So the model was an excellent fit to the data, although the associations were more modest in the beginning part of the model between compassion levels, anxiety levels, and pain. So overall, what we could conclude from this study is that patient-rated physician compassion was linked to surgery outcomes, including anxiety and pain management, that relate to risk of chronic pain and opioid addiction later. That effect was observed indirectly through lower levels of anxiety, and the results suggest a biopsychosocial pathway through which compassionate care may help optimize surgery outcomes and reduce the risk of opioid addiction. Our future studies plan to investigate compassion disparities that may contribute to health disparities. So when it comes to envisioning the future of pain management in the context of surgery, It's important to remember that caring does make a difference. Thank you.